The alarming rise of sugary drink consumption is fueling a global health crisis, particularly in Africa. This growing epidemic is linked to various chronic diseases affecting millions of people. According to the Center for Disease Control and Prevention, frequently drinking sugar-sweetened beverages is associated with weight gain, obesity, type 2 diabetes, heart disease, kidney diseases, non-alcoholic liver disease, tooth decay, cavities, and gout. To combat this pandemic, experts urge government to take bold action through taxation and regulation. Experts are also recommending the implementation of sugary drink taxes, enforcing stricter labeling and advertising regulations, promoting healthier alternatives and education, and supporting research and monitoring. Joining us for this conversation from our Abuja studio is the Senior Program Manager for Justice, Corporate Accountability and Public Participation, Africa, Bayomi Sarumi. Good morning and thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
All right. So this is a very controversial tax. Well, some call it the sugar tax. Some call it the SSB tax. But what's your perspective of this, taking into consideration the freedom of Nigerians to take whatever they want?
Thank you very much. Once again, good morning. Let me clearly state that when they say sugar tax, it is a means of the people that will call the industry producers of SSBs, sugar-sweetened beverages, to push the people against the government. It is not sugar tax. Sugar is different from sugar-sweetened beverages. Sugar-sweetened beverages is what Nigerians usually call soft drinks. I must also say that soft drinks have had impacts on our health. So to respond to your question, sugar-sweetened beverages tax is the right name for it. This is the tax levied on carbonated non-alcoholic drinks, like I said, that Nigerians call soft drinks. And like you've said at the opening, this contributes to a large problem of non-communicable diseases, which is responsible for the deaths of over 41 million people globally. It is also said that this contributes to the deaths of about 17 million people less than the age of 65. Sadly, 70% of these deaths is recorded in low and middle income countries where Nigeria falls in. So it is very expedient that government takes action, and it's understandable that people say, oh, freedom of choice. But what government is doing when taxing soft drinks, for better understanding, is to help Nigerians protect themselves and promote public health. Because the cost of managing these diseases are skyrocketing by the day. And 70% of Nigerians pay out of pocket for health. This is huge, this is disheartening, and it is one thing that needs immediate action. So what to do is to help people reduce the burden that they incur financially and health-wise. This brings us what we call a win-win situation, a win for the individual, a win for the government, because our national health outcome is very, very important for our national productivity. While we might want to, take it easy on revenue generation and all of that, we must ensure that the health of Nigerians are protected. And this is sacrosanct because the government also took a note to say that Nigerians will be protected. So a preventive measure like an effective SSB tax, not just any tax, an effective, well-implemented, well-structured, evidence-based SSB tax is very, very important. And this has nothing to do with repressing the people. This is pro-people, this is pro-health, and this is what is good for Nigerians and the country at large.
All right, so you're mentioning that this is pro-health, is what's good for Nigerians, and many people ask the question, how do you know what's good for me? Pardon me, I'll have to play the devil's advocate in this regard. You are in Abuja, where possibly there might not be traffic, but for people who live in places like Lagos, where traffic is synonymous with Lagos State, and you can be in traffic for hours on end, and you're hungry, and these are the things that you can easily get in those traffic to eat. What are the alternatives for us?
Thank you very much. You know, before we go into the issues of alternatives, we need to understand that when we consume things, they have impact on our body. So what do we want to do? Do we want to, you know, hasten our death by consuming because we are in traffic, you know, make your health bad because you're in traffic? True, we are in Abuja, traffic might be lesser, but some people in Abuja would also say, oh, I've been in the sun for quite a number of hours, so I need something to, you know, reinvigorate me. But this is the point. Yeah, to cool off, but this is the truth. What cools you off is water, and that is the alternative. It is not sugar-sweetened beverages, because what that does, it spikes up your sugar level. You know, you're taking a sugar rush that begin to build up a level of sugar that your body cannot manage. This in turn leads to a lot of diseases. Thankfully, I was watching the session before mine. I heard the mention of the minimum wage. Let's agree that the minimum wage is now 80,000, 100,000, and that is for people that are gainfully employed. The cost of managing diabetes alone, monthly, it's more than the minimum wage. And these are people, we Nigerians, who would have to pay school fee, you know, take care of a family. This does not just impact our health. It impacts our social structure. Because, you know, when somebody is down with NCDs, these are lifelong diseases that need care, lifetime care, which means somebody has to stay with that person. You know, you are losing productivity. You cannot even earn more to take care of yourself. Again, this is a country where more than 70% of us pay out of pocket for health care. If you need Panadol, you go over the counter, you pay for it. No properly structured health financing system. So what we are saying is not just because we want government to tax these products. It's because, again, evidence have shown everywhere that these drinks have no nutritional value. In fact, as of December last year, the WHO also said that some of the sweeteners, you know, some people will say, oh, this does not contain sugar, we've used sweeteners and all of that. These sweeteners are also carcinogenic. They are cancer-causing. So we have to be very, very careful. Thankfully, you mentioned some of the diseases that are linked to consumption of SSBs. But about 15 cancers are also linked to that consumption. Let us begin to look at these issues critically. I like that we play devil's advocate because it helps us to bring out the issues the way they are. We can interrogate it better. We are not saying don't interrogate these issues. We are saying that evidences have shown that this is good for us, this is better for the people. And again, on the issues of alternative, there is no better alternative than water. Thank you.
Okay, so looking at a statement I've read earlier, the executive director of CAPA, Akimbode Oluwafemi, was saying that in Nigeria, beverage companies continue to exploit false narratives and inaccurate health claims with disregard for the health of the people. Well, these beverage companies might have the funds to go about doing campaigns, adverts, billboards everywhere just to sell their products. What are we selling as a government, as a people? What is the government doing? Is the government having corresponding campaigns to sensitize Nigerians on the dangers of taking these soft drinks?
Again, thank you very much. Before I answer properly, let me also say thank you to your organization for giving us this platform, because this is one way to, you know, sensitize the public, let them know what is going on. And we must also commend the government, because in 2021, the government of President Muhammadu Buhari instituted the SSB tax, a 10 naira excise duty tax on sugar-sweetened beverages. And that was why, again, I mentioned that the tax must be effective. For effectiveness, it means it must considerably impact on the final retail price of this product. So 10 naira in 2021, you can imagine what it means in 2024. So it means it has no impact. And like you mentioned, Akimbode Oluwafemi of CAPA, we also had a a simulation study that looked at the data in Nigeria, the level of consumption, the purchasing power, the price at the time in 2022, and the simulation proposed that the best tax rate should be 130 naira. So what the government needs to do is to go back to the Finance Act and say the 10 naira excise duty on SSBs be moved to 130 naira. But the government can also do better, because the 10 naira in 2021, when product of your most popular SSB was about 150 naira, it's still 10 naira now that the product has gone to 400 naira because of the prevailing economic conditions, not because of the tax, but because of the prevailing economic conditions in the country. So the government still gets 10 naira on that liter that sells for 400 naira. Considerably, we know that the industry, as part of their own effort to kill this tax, they absorbed the 10 naira. They did not pass it to the consumer. Now, if it is considerably high, about 130 naira, adjusted for inflation, it will be high enough that it is passed through to the consumer, and the consumer begins to adjust his or her consumption. What again we need the government to do is to now put it in percentage, a percentage of the final retail price. So our study was based on the existing structure of the tax. Now, what we need the government to do is to put this tax at a minimum of 20%. That is the minimum. But we can do better. We can go 50% like Qatar, like Saudi Arabia and other countries. We can even go 100%. But it's not just to tax alone. These taxes must be plowed back into public health. So when the government goes back to say we are increasing these taxes through the Finance Act, it must make a provision for earmarking of these taxes. And on our part as an organization, we are building a coalition of Nigerians, young people, Harvard, across generation, across sectors, to build a movement of people who would not only demand for taxes, but also sensitize the public. So we go into communities, we go to we go to television stations like yours. Again, many thanks to you for giving us this time. We do digital media campaign, but we do not have that money like the industry would have it. So when I'm saying the industry, I'm referring to the producers of SSBs. So they have this huge advertising budget, and this is why we believe that policy engagement, a policy at the national government that taxes this beverage, that earmarks these taxes for public health, is the most effective pathway, because it impacts at population level. So in addition to the taxes, we continue our engagement with governments, we continue with legislators, we come on TVs, we go on radio, we use newspapers. But the most important part is to have this tax raised and ensure that the industry is not at the table when these decisions are made. Because again, like we've seen, what they will do is to delay or deny or dilute this these policy interventions to suit their business. Thank you.
And that's bringing me to the next question about what the outcome of that report by African CSOs, including CAPA, what the outcome of that report was. But before we go into that, I understand that CAPA and other CSOs are also calling for a regulation of SSB tax, sweetened beverages, the distribution and all that. How's the government going to balance it, the public health concern of this, and also not stifling these businesses? I mean, there are also industries that have been, a lot of money have been invested into them.
Thank you very much. These are questions that we also get to answer every day. And again, it is nice that we are doing it on TV, so we are able to reach more people. The first thing is public health trumps profit. When it is public health or profit, the answer is public health. No doubt about that. But this is the argument. When you say that a particular company recently promised $1 billion to the government of Nigeria. They promised it in 2021. They promised it 3 times, and no impact. However, that same organization said it made 300 billion naira in Nigeria and paid a 90 billion tax in Nigeria. Let me tell you frankly that this tax, this money, this revenue they made was made on the back of Nigerians' health. Nigerians who cannot afford to pay for dialysis, who cannot afford to pay for their insulin, who cannot afford to cater for their family because they are already down with 10 cedis. So these people line up their pockets off the health of Nigerians. Again, public health trumps profits. But this is one thing that we should all do. Think of that, your best SSB, your soft drink, the one you like the most. Think of that brand. You would see that they also produce water. So they are not going out of business. They are still in business. They are producing a lot of things that are healthy. So if this tax is high enough, it can incentivize them to reformulate and produce products that are healthy. So we are not taking them out of business. The government is not taking them out of business. This business they are doing, this money they are making is off the back of Nigerians, off the health of Nigerians. And the cost of SSB is not what you pay at the point of consuming it. It includes what you pay at the hospital. It includes what your family suffers for it. It includes what the country as a whole suffers for it. Again, public health trumps profits. But on the call for control, advertisements, and all of that, it is very, very important because kits are being used to market these products. At the heat of this conversation, a representative of the industry said SSB, soft drinks, have become staples for Nigerians. It is an indictment on the government that SSB, an unhealthy food, is a staple for Nigerians because food, it means we do not even have food security. We do not have food sovereignty because unhealthy diet through westernized habits means that we are not consuming foods that are alien to our system. Right. So what we need to do alongside effective taxation is to control the promotion of this product. False health claims should be banned. Marketing around school, advertising to kids should be stopped. These kids, when they see this advert, when they see a popular footballer carrying a can of a drink and he scores a hat-trick from that, the kid and the parents want their kids to become that popular footballer because of that drink. That drink has no correlation with the skills and talent of that footballer. But the industry has manipulated our mind through their adverts, doing their subliminal messaging. When you take a gulp of a drink, they say it refreshes you. And it does not. This is the truth. It is just placebo effect. When you take it at a particular time, when you are testing and you take a bottle of SSB, a cold one, in 5-10 minutes, you are hungry for more. But when you take a 30 cl of water, you cannot go, in 10 minutes and take another one. You cannot eat these things and say you are filled up. That is why you are going to consume more, and it leads to addiction. And there are a lot of issues around consumption of sugar-sweetened beverages, which also include addiction and impact on mental health. But we are not even talking about that right now. We are talking about protecting kids, because we have to take this promotion, we have to strictly regulate the promotion of this product. Take it away from schools. Thankfully, I am aware that some schools have already informed their parents of their wards to stop giving them SSBs. In Nigeria today, when you are packing the lunch pack for your kids, you are putting one or two SSBs. When you can put fruits, when you can put banana, when you can put all of these things that will help these kids. Again, what must be said clearly is that SSBs have no nutritional value. It is dangerous to our health, just as much as it is dangerous to our economy. So if we are protecting our economy, it means we have to protect the people that are producing to sustain that economy.
Okay, so if you are saying that it's not good for our health, excuse me, a lot of these SSBs, these companies use the same method, the same methodology to promote their works, like you have mentioned. One taking a soft drink and a footballer taking a soft drink and scoring a hat trick. I mean, it sticks in the mind and all of that. Why do we have this kind of deceptive adverts go on air every time, and yet we're looking at stopping or reducing the intake of these drinks?
Thank you very much. I think that, as I believe that these products are still legal products, so we've not been able to say an outright ban, right? So, when you look at industry narrative, when you buy a product, they want you to associate it with something. Is it good health? Is it superpowers? Is it that you can think better? You know, this is why we call it the industry playbook. It is not new. They've done it on tobacco. They've done it, the big food is doing it, the big tobacco is doing it, the big beverage is doing it. So what it means is that they have a standardized way of engaging to ensure that their products are in the faces of everyone. There's this popular chips that they say is potato chips, which actually has no form of potato in it, that devotes about 100 million USD to advertisement. Recently, a multinational beverage company in Nigeria took some influencers from Nigeria to holiday in the US. So these issues, you know, it's about attacking the mind of the people. They want them to, you know, enjoy. So let me give you a quick example. We went to a community in Abuja here, Kiyi community, and in this community you would see every variant of beverages, but you will not see potable water. And in this community, when people go to health centers, they have to bring a bag of water, a bag of pure water, to care for their people. So I'm telling you this story so you know how hard these people have worked. Their products are in nooks and crannies of this country. They are everywhere. We are also conducting an assessment in country in about 7 states that is looking at the penetration of these products and the way they advertise them.
All right, Mr. Sarumi, I'm sure you have a lot more to say about, you know, the SSB tax, but we can't leave the conversation for today. I mean, you've done enough in terms of, you know, a call to action for Nigerians to cut down on, you know, the excess consumption of, you know, sugary drinks, especially to those of us even in the studio here. Thank you for joining us. Senior Program Manager, Food Justice, Corporate Accountability and Public Participation, Africa, Abayomi Sarumi. Thank you for joining us once again.